a runner, a weightlifter, an average person working in the office, you may have knee pain, back pain, foot pain, and all of these things can be alleviated with some custom orthotics. These can be very great for some people. Always consult your medical professional to see if they're right for you. But today, we're going to take a look at how you can fit your orthotics into your shoes and how to properly take care of them. Okay, what you will need today. First step, shoes. Custom orthotics, which you'll receive from your healthcare practitioner after they get done and with the analysis. A pen or a pencil, and some nice sharp scissors. So we've taken out one of these orthotics, and for patient confidentiality, because these are actual real orthotics, we've just put a tape here to maintain that. So we got one for the left side of the shoe. So what you're going to do is take out any sort of pre-existing either orthotic or any sort of pre-existing foot support, so that way the bottom is nice and empty. You're going to use this as a mold to make sure these fit. Now in this case they actually match up really well. They're pretty much equal. Now if they didn't match up, this is where you would use your trusty pen or pencil and you would draw an outline surrounding the orthotic. That way afterwards you would take this off and you would trim it. That way you make sure it goes in properly. If you find that if you just put the orthotic in right away and you find that there is some bunching at the very end, that you feel it's twisted and bunched and you feel your feet hitting it, that is a sign that you need to trim it. So again, make sure you get the original shoe support. Just make sure that it fits. In this case, it actually pretty much matches it. So we're going to take this, nice and simple. We're going to put it right inside, just like that. So it replaces it perfectly. Make sure the back of it is touching the very back of the shoe. Okay? And you're just going to go ahead and feel, and we're good. There's no bunching at the end or anything like that. It's a perfect fit. Now that you have your orthotics trimmed out and sized properly for your shoe and they're in here, we're going to have a few points about how to use them properly and make the most out of your orthotics. So to get started, make sure you're going to wear these 1 hour on the first day and then doubling that every day afterwards. So that means 2 hours on the second day, 3 hours on the third day, all of which indoors, just so that your shoes can accompany and mold to your feet as well as the orthotics so that you can get used to it. Another important aspect is the odor. You could use foot powder if you're someone who is used to it or has a lot of foot odor. Foot powder is totally fine. It's not going to ruin your orthotics. It's going to be totally okay. If the orthotics do get wet, make sure you let them air dry. Do not use a blow dryer or put them against the vent, the heating vent or something like that. That'll just ruin your orthotics. Just let them out, let them air dry, and then afterwards you can slip them back in. Another point to talk about is what if they actually get dirty? What if something happens to them? Well, don't put them in the washing machine. Don't put them in the dishwasher. They're not dishwasher safe. Use some mild soap, some little bit warm water, and you're just going to gently clean them and then let them air dry again. Last but not least, if you do feel that there is pain in the foot or from the orthotic specifically in the bottom of the foot and there's a lot of discomfort, go speak to your practitioner. The orthotics may need to be adjusted at the lab or something else may need to be modified for it to fit you properly. But expect that in the beginning it will be a little bit uncomfortable but not necessarily too painful, and that it should go away. If it doesn't, again, talk to your healthcare provider. They should assess it again and speak to you about the proper way to move forward from there.